Welcome back, ladies and gentlemen, to Babylon Health's channel on a mission to provide affordable and accessible healthcare globally. Joining us, Saurabh, the Chief Science Officer, who's going to give us some clerical insight into his background and Babylon with his involvement moving forward. But first and foremost, welcome, sir.
Great to be here, Kyle. Looking forward to the conversation.
And a pleasure to get you on. So first and foremost, I mean, you have a long history of how AI and health work together with experience at the World Health Organization as a member of the Artificial Intelligence for the Health Focus Group. How does AI kind of play an integral role with Babylon and your involvement with it?
Yeah, so AI has always been central to our mission. I think you mentioned the mission up front, which is affordable and accessible healthcare. And that's really a mission that requires the use of intelligent technology, AI being a kind of prime example of this. And that's because we want to deliver scalable solutions to deliver personalized healthcare advice to our members, but also to help augment and support our clinicians as they deliver care to our members globally.
Now, rolling back a little bit, you've been with Babylon since 2018, but what kind of history led up to that aha moment that got you to jump in?
Yeah, so I guess I've recounted this previously, but it wasn't really something which it was kind of, I was compelled really to join Babylon. It was not really, it was almost as if this role was kind of suited for me, right? So it was the mission, the people, the scale of the challenge, particularly looking at it from a kind of AI and scientific lens, the opportunity to kind of thoughtfully re-engineer how we might disrupt healthcare was really the kind of the kind of items there which really kind of appealed to me. I was compelled by that kind of the challenge as I mentioned, but also really the opportunity to leverage some of the kind of most cutting edge methods, the most cutting edge technologies from the leading research labs which I'd worked in, to kind of have a positive impact on the lives of members on a daily basis. And that's something which continues at Babylon. Babylon has that environment where you've got this great collection of people, clinicians, product managers, engineers, but also AI ML scientists, of which I am one, but I'm doing less hands-on coding to actually deliver products which are informed by that cutting edge technology. So that's really what led me here. And it's kind of encompasses a lot of my background. So got 20 years of experience of developing AI and ML solutions for healthcare. That includes 12 years working in academia. So I kind of worked on a number of different applications of statistics, machine learning in healthcare, ranging from applications in genomics to drug design to infectious disease epidemiology. So that's something which is, very relevant to most of us in the world because of the pandemic, which we've recently been through. But I was also involved briefly for a time looking at how to build some of those models, how to leverage large volumes of data to inform policy, how to inform interventions. And, I've still got some of those close ties with academia. I've got an honorary position still at my alma mater, which is Imperial College in London, which is one of the leading research universities in the world, and it's using the types of techniques and technologies which I kind of developed over the course of my career, which was which kind of gave me this opportunity to lead a team here at Babylon to apply some of those methods to the healthcare challenges which we're trying to solve.
And I think for the first time, really, people are starting to appreciate the value of AI when you're starting to see it bleed into social media. But I think the real prevalence is going to be coming out of the healthcare sector. So I just got to ask you, kind of moving forward, how do you see your involvement moving with Babylon, and just kind of any further insight moving into 2023?
Yeah, so as I mentioned, Babylon has always considered AI to be integral to everything we do. That was true 6 or 7 years ago when we, probably 6 or 7 years ago when we first developed our first AI product, which was Triage. And that was really important to delivering self-care advice to our members or our patients who had symptoms and actually just wanted information about what is the underlying cause of those symptoms, what should I do next? So that's important to empower patients and members, but also to lessen the kind of impact on our clinical teams. So oftentimes there is this kind of high demand on our clinical teams. And, there's cases where some of that can be dealt with through automation, through AI technology. So how can we provide members with care and advice without them having to speak to a clinician. And that's very similar to the types of approach which we'll be taking going forward. So we're managing large populations. And what we're trying to do is to use AI, machine learning, and other advanced technologies to try and understand in our large populations, where is the biggest burden of disease? How can we identify those people who are in need of care most urgently, so that actually we can intervene and ensure that actually they get the right advice at the right time? But then how do we also actively use AI technology to continuously monitor members so that we can actually monitor in real time and respond to what we're understanding about that member or that patient in real time? So again, how do we intervene on that member? But it's, again, not just thinking about AI in terms of monitoring, but it's also thinking about AI in terms of the personalization aspect. So what we have at Babylon is this incredibly engaging member experience. And the reason that's important in a healthcare context is sometimes often kind of not maybe so well understood, but what we know is that engagement with healthcare is actually positively correlated and is highly predictive for good health outcomes. So how do we use AI technology to really personalize the experience of care, either through the care delivered by clinicians or via a product such as the product or the member experience which we have today? How do we ensure that that's a highly personalized experience so that actually the information and advice given to members is appealing and is relevant to those members, so that actually they can follow that advice and actually, improve health outcomes overall? So that's how we're thinking about using AI. It's not even how we're thinking, that's how we are using AI. And that kind of experience of using AI is going to evolve over time to deliver increasingly personalized experiences.
Well, I definitely appreciate these clerical insights, and I'll pass the question off to the viewers. We'd love to know what you guys think about all of us in that comment section below, and consider subscribing, because as news continues to hit the wire, of course, we're going to update you here. But stay cool, stay awesome, and as always, we look forward to catching you in the next one.